Hello, I'm Dean Watson from the Watson Headache Institute here in Adelaide, South Australia. Today I have Romain Giop with me from Belgium. Romain did our Level 1 course in Varese in Italy in May this year and has travelled to Australia to do the Level 2 course and also observed me in the clinic. Welcome, Romain.
Thank you.
Romain, I understand that you are a clinician,
Yeah.
a teacher and a researcher. Can you tell us a little bit about your role as a clinician?
Yeah, so we got a headache clinic in Belgium and we collaborate with neurologist, dentist, physiotherapist of course, and a psychologist, and we try to highlight the headache, the migraine, and how to have a good care of the headache field.
Thank you.
And so in the other hand, I'm teaching TMG courses in private courses. And again, it's to try to put attention of physiotherapy about TMG, about orofacial pain, and of course headache. And the third end is I started a PhD 1 year ago about migraine.
A brave move,
Yeah.
PhD.
Yeah. So
Good on you. Go for it.
Yeah, I hope that will be great. The goal of the PhD again is really to put physiotherapy and migraine in the same area and to really move in that direction, that maybe medication is not the end of it, it's not always the solution for patient, and maybe there is a good things to do with manual things, manual therapy, physiotherapy, and education of the patient.
I understand that, so you've been focusing on headache and migraine for the last 5 years.
Yeah.
How did your interest come about in headache and migraine? How do you think you arrived at this sort of, specialty, if you like?
I really think it's the gap of physiotherapy in that field that really drive me in that way. And I've been lucky because I met really good dentists, really good neurologists, which drive me and really put me on that track.
It must be great to have that support.
Yeah, it is. It is because it's rare.
It is rare.
Sometimes complicated.
Mm-hmm.
But yeah, it's really because we know in headache, a lot of patients don't feel happy with the medication, or medication doesn't have that much long-lasting effect. So maybe we can give them some other
another option.
Yeah.
Another alternative to the pharmaceutical management. Yeah. Agree totally. So Romain, why did you come to do the course? How did you hear about it?
Because I try to first go in classical courses. I mean, Maitland approach, Mackenzie approach, Milligan approach in my headache, and I was always quite upset because it didn't work so well. Or maybe I get the feeling that missing something, and we know that again it's concept that we are in. They propose some treatment about headache, but this is not the core of the concept. And so I was really trying to find someone which have a concept really in headache and which a concept lying on the core on headache. So by looking for a lot of concept information, I found yours. I read your paper, and I thought, makes sense to me. So I decided to follow the Level 1 courses.
Thank you for that. How has it changed? I understand you've just been familiar with the approach since doing the Level 1 in May, so you've not been using it for long, but has it changed the way you've looked at headache? If so, how has it changed the way?
The main change is first in my assessment and the way that you're teaching the assessment is really changing me a lot, and I'm really more connected with the body shaft, and this is important things of your concept that I do appreciate. I'm making more and more education with the patient, explaining why we do that, explaining where I put my hands, and of course more hands-on technique, but some techniques that I do really appreciate in supine position. And this is really the big change I get from the concept. It's making more body chart assessment, making more education, and have that manual approach on C2 treatment.
So having done the course at level 2 now, and thank you for coming all this way to Australia to do the level 2 course. Appreciate your commitment. So what is it that you like most about the Watson-Haddock approach? Yes.
It's really the combination of that 3 pillar. I mean, assessment, education, and manual things.
Mm-hmm.
Because sometimes, and I do believe that in the way of physiotherapy is moving, I think we did too much hands-on before, and now we do too low hands-on.
Mm-hmm.
And so I think it's good to have a concept which is proposing a more hands-on, but it's not all the concept. And I know a lot of physiotherapists think that your concept is just about hands-on,
mm-hmm.
and there is hands-off. And so it's really a thing which attract me and which drive me to do that level 2. And in the level 2 we did a lot of more assessment, and it's really good to master again that concept.
Yeah. So Roman, I really do appreciate the commitment you've made and the ongoing advocacy for the role of cervical afferents in headache and migraine generally. I really do appreciate your support there. So once again, thank you for coming all this way. It's been a pleasure to have you in the clinic, and I look forward to seeing you in Europe later this year in May. So so we'll see you then.
Yeah.
Thanks again, Roman.
Thank you.